is Maggie, and Cameron, Elizabeth, and I will be presenting on how minority groups have been affected by COVID and have been helped through this one nonprofit organization. So some information on minority groups affected. It's located in Northern Virginia, and it's mostly a Hispanic and Latino population. Above is a picture of the doctors that serve the patients in the area. So they're located specifically in Arlington, Alexandria, and Fairfax County. And this graph shows their employment status. So it's low for the area. It's around 0 to 5% based on the above graph. And without employment, people are less likely to have health insurance through their work and are also less inclined to have the capacity to pay for services that are integral to their health and well-being. So some demographic details include that their per capita income is about 58 to 60 grand a year. The senior population is low, it's 10 to 13%. So for context, both of those are under average for what we see at large in the country.
The grassroots organization helping combat this issue is called Neighborhood Health. Neighborhood Health started out as a small clinic in hopes of providing preventive and routine care for low-income and immigrant women in the Alexandria, Virginia area. Typically, low-income families or immigrant families don't get the health services that are necessary to maintain a healthy lifestyle because of the cost and lack of health care. So this organization's goal is to improve health and advance health equity in Alexandria, Arlington, and Fairfax County by providing high and quality primary care regardless of the ability to pay. A little bit about the Northern Virginia region is that 6.3% of the population is living below the federal poverty level, and 9.6% of the overall population lacks any type of health coverage. Some services included are family and internal medicine, pediatrics, women's health care, and dental health care, behavioral health, and HIV and AIDS care.
The health impact of COVID is reported 4 in 10 adults in the US experienced an anxiety or depressive disorder, up from 1 in 10 adults back in 2019. And that the Hispanic and Latino population are 1.7 times more likely to contract COVID-19 than their non-Hispanic white counterparts. And this graph shows how minority groups are more impacted by COVID versus the white population. The biological impact of COVID-19 is it negatively impacts children's developing brains, immune systems, and ability to thrive. And the environmental impact is that there is an increase in medical waste.
Overall, Neighborhood Health serves 40,000 patients in the Virginia area. And they've been helping people since 1977 when they became a nonprofit organization that wouldn't otherwise be provided to them. This is the conclusion of our presentation. Thank you so much for taking the time to listen.